Thank you and welcome back to Blood and Guts, Surgical Expert Roundup. And we're going to be talking to a very special guest today. And I'm pleased and I'm honored to introduce Dr. Mark Friedman. I've known Dr. Friedman now, it's coming up on 7 years, believe it or not, because it's now January 2025. And I got involved and introduced to Dr. Friedman through a telemedicine company called First Stop Health, which I have been a part of for the last 7 years. So welcome, Dr. Friedman.
Thank you, Steve. It's a pleasure to be with you here today.
So let's talk first about First Stop Health and telemedicine, because back when I started in telemedicine, everybody thought I was crazy. How could you can't talk to patients over the phone, and that's not how you're trained, and you can't do it without examination. And then COVID hit and the game changed. So tell us what is First Stop Health and what is telemedicine?
So First Stop Health was part of my attempt to fix a lot of the things that were wrong with healthcare. And not only from the patient perspective, but from the perspective of a physician. And when we started doing this, we tried to answer the question of what was wrong with healthcare and what could we do to fix it. And I looked at it personally from the standpoint of what I didn't like about what was going on in my own practice, and how I could make it more fun again and more enjoyable to practice medicine. And I came up with a series of ideas that we put to work in First Stop Health. The whole concept of telemedicine, believe it or not, is not a novel thing. I mean, when Alexander Graham Bell invented the telephone, telemedicine was born. And back in the good old days, when we all had family doctors, you could call your doctor on the phone and get advice, right?
Right.
Well, doctors stopped doing that. Why? Because number one, they were being frightened by attorneys that they could get sued for what they said on the phone.
Right.
And number two, they were not being compensated for what they said on the phone.
Right.
So, I when I started working in the emergency room, if it was quiet and I was bored, I would answer the telephone and I'd pick up and say, "Hello, this is a nurse. How can I help you?" And people would tell me what was wrong. And I would always tell them, "Oh, you need to come into the emergency room." Because if I didn't tell them that, number one, I was afraid I could get sued. And number two, I wouldn't get paid. Right.
Right.
We had to fix these two problems. And we also had to fix other issues such as access to care and physician convenience and the whole medical record morass. And so in setting up my own company, I was able to address all these issues successfully, as it turns out. And we eliminated a lot of the headaches that physicians deal with now in medicine and made it a much more enjoyable process for both doctors and patients.
So let me ask you about that. There are a lot of telemedicine companies now out there. Tell me how First Stop Health is different from some of the other publicly traded companies that I use in my own health insurance. I'm a federal employee. I have Blue Cross Blue Shield. When I log in on the home page, Teledoc pops up, and for my $25 copay, I can speak with a doctor.
Right.
How is First Stop Health different?
Well, First Stop Health is different by, first of all, turning the whole paradigm on its head. Typically, the big players like Teledoc try to sell their service for a very cheap, inexpensive price, and then hope that you don't call them, right? Because they get paid no matter whether a patient calls or not. And if they have to deliver the service, it costs them money. If they don't have to deliver the service, it costs them nothing. It's sort
Right.
of the typical insurance paradigm. You're
Right.
paying out a premium, and the insurance company is hoping that you don't have a claim, that you don't have to
Right.
get paid out, right? First Stop Health turns that on its head by saying we want people to call. We're selling a service. We're not selling insurance. Okay. And we guarantee our clients, who are the self-insured companies that our patients work for, that we're going to save them money by keeping people out of the emergency room, urgent
Right.
care clinics, and even the doctor's office when it's appropriate. Okay. When they need to go, we send them. But when it's appropriate and we can treat them via telemedicine, we're saving the client the basic insurance function money. And we make it convenient for the patients to call us. There's no copay, there's no deductible, there's no out-of-pocket cost to the patient. Their
Right.
employer is paying us up front. We're paid in advance. So we know how much money we're making each month.
Right.
We can therefore, fund our overhead, right? Our office people. Our doctors are mostly paid on a per call basis. So
Right.
if we have a call, we pay the doctor. If we don't have a
Right.
call, we don't pay the doctor.
Right.
And we guarantee our clients, the insurers, that we're going to save the money each month. If we don't save the money, they get a refund. So the
Wow.
patients are happy because it costs them nothing. The clients are happy because it literally costs them less than nothing. Our
Right.
doctors are happy because they get paid when they work, and they can work whenever and from wherever they want. There's no
Right.
on-call schedule. There's no requirement for them to see a certain number of patients an hour or a day. And everybody benefits.
And your calls are recorded, correct? Because not all
Yes,
telemedicine companies record their telephone calls. So that
we,
might take some of the liability
well,
rather than he said, she said.
we struggled with that concept initially. I personally wasn't sure that I wanted my own calls recorded. But then I thought about it and I said, if we do the right thing and we say the right thing, then why not record them? It's only to our benefit. It serves as a backup to the medical record, and it solves one of the major problems with medical record keeping, right?
Right.
Because essentially the call's recorded, so we can have it transcribed if the medical record is inadequate.
And probably
Well,
a lot of doctors don't document as well as they should, is my guess.
this is true too.
I would assume that would be
It
true.
also, it's a tremendous asset for quality assurance purposes.
Right.
And we review
Right.
regularly and constantly a significant percentage of all the calls. We listen to every call for a new doctor.
Wow.
We listen to 15% of the calls for all the doctors. We're now
Good.
working on an artificial intelligence system that can listen to every single call.
Yeah, that's interesting. I was going to segue into AI. Do you ever, how do you envision in the future AI either screening some of these things or, I don't know, having
Well,
patients,
first of all, artificial intelligence is a tool,
right,
like any other tool, like our stethoscopes. Okay. And I personally have been using artificial intelligence even before the term was coined. Okay. Because, and this is an important value add for telemedicine. While I'm on the call with the patient, I'm sitting in front of my computer.
right,
I have access to the entire medical knowledge base. And so while I'm talking to the patient, I can go to UpToDate and research a symptom or a diagnosis, or go to Hippocrates and get drug dosages. I can go to artificial intelligence on the general internet. There's a program now, artificial intelligence diagnosis, and there's several other diagnostic engines available. And you put in the symptoms and it gives you a laundry list of potential diagnoses. So all of a sudden, I'm a lot smarter than I used to be. I'm way
Right.
smarter than I used to be. Certainly when I left medical school, it's not that I know more, but I know how to find out the information faster.
Right. And I think that's important because things change. I mean, the
Yes,
first line drug for certain things change,
right,
recommendations change.
right.
Right. No, I think that's important. So let me ask you about the medical legal thing, because as you may or may not know, back when I started, I've always wondered about the liability because any of us can get sued for anything. And I had never, up until the last month, heard of a telemedicine doctor being sued. But there was a recent case that you probably heard
Yeah.
about that I don't know
Oh,
who got it
One
was
Medical,
right,
Amazon. Yeah, yeah.
right.
Uh,
But I mean, if you again, we don't know exactly what happened, but from what the news says, which it may or
it
may not
always
be true,
sounds terrible on the news. Yes.
right? I mean, but the symptoms of, coughing up blood, shortness of breath,
Mhm.
nobody I know that works for First Stop Health would not immediately, am I
Right.
calling 911 for you, or
Yes.
you need to go to the emergency room? I mean, those are the things
Well,
we ask.
this is where quality assurance comes in, because
Yeah,
we have hundreds of doctors working for us. And in order to be sure that they're doing the right thing, we have to know what they're doing. And the
right.
only way to do that is to listen to their calls. And so, our physicians listen to the calls, our uh, technical and non-medical people listen to the calls. We have nurses who listen to the calls. Other doctors listen to the calls. Whenever we hear anything that's not right or makes us suspicious, we contact the physician. We talk to them. We say, gee,
Hmm.
we listened to this case and this is what you did. This is what you said. Maybe you should have done it a little differently. Maybe you should have done this and not that.
Right.
And it's tremendously successful in terms of helping doctors practice better and more, adhering to the standard of care. And it identifies the physicians that we want to get rid of and send to our competitors.
Hmm. Yeah. Do you think all the other companies that have as much quality
No,
background that you
I
all
don't,
do?
I don't believe they do.
I don't believe they do either. Yeah, I don't believe, and I think and it
Mhm.
makes it difficult, especially if you're a telemedicine doctor and a family is calling in and one child is treated different than what you want to treat that child. The one day of a runny nose, we don't normally give amoxicillin. And if you're the doctor following up on that second family member, they want the antibiotic. And it's a
Right.
challenge.
It is a
And
challenge.
and as you know, patients look at a successful telemedicine call if they get what they think they need
Right.
or what
Yes.
they want.
Unfortunately, giving the patient what they want is not always the best thing for the patient.
Right.
And they need to understand that. And most of the time they do when you explain it.
Well,
Occasionally,
that's true.
no,
That's true, but it's very
occasionally,
interesting because you've done clinical medicine a lot. So, and I still do clinical medicine. Patients act very different when you're standing there in person and you're having a no, I don't think you need an antibiotic because of one, two, three versus on the telephone.
yeah.
It's amazing, right? It's
Some people call and they think that we're just a drug ordering service,
right.
and what they want and need is what they're going to get from us. And it's unfortunate, but we do our best to explain to them why that's not the case, and that it's in their best interest to follow our advice and not just let us follow their advice.
Right. And I think the other thing that's beneficial to First Stop Health, with no other company that I know of will do, is a second opinion. Where if the patient's unhappy, you want to speak to another doctor, no problem. I do not know of another telemedicine company that does that. If the doctor says no, it's no, and now you have everybody's angry.
Right.
So certainly that's another benefit that,
We always offer people the option to talk to their doctor or
right,
go to urgent care or the emergency room or get another telemedicine visit
right.
because no one is all knowing.
Where do you see AI improving already what First Stop Health has?
I see a lot of potential applications. The first of which is just reviewing all these medical cases that we have for things that need to be flagged and addressed, right? So that we can say that we literally review 100% of our cases, which is
Right.
going to happen soon. So that's
Good.
thing number one for quality assurance. The next thing is to help the doctors in real time, as I already discussed, to make a diagnosis, to treat the patient. If you've got resources at your fingertips, I've diagnosed diseases via telemedicine that I've never even heard of before. Because
Wow.
while I was speaking to the patient, I accessed the diagnostic engine, put the symptoms in, and it gave me a differential diagnosis list that I was then able to look at and say, oh, you know what? I think they've got this.
Right.
Certainly for treatment options, AI is a potential, game changer.
Well, I guess the way I think about it too is that we have access, patients have access to what we have too. And I can see, Dr. Friedman, I looked it up and that's not true. And you can say, well, no, I'm looking it up too. I think that is true, right? I can see a
Well,
little.
I've had these kinds of conversations with patients, and
Yeah. Right.
sometimes they have looked it up and they know,
Right.
and they
Right.
may know something that I didn't know.
Right.
And when that's the case, I'm the first one to admit it, you know,
Right.
as long as their source is a reputable, and verifiable source, and I agree with the source, then
Right.
I'm happy to accept that.
Right.
Um, if often and probably the most times what happens is people look things up on the internet and they frighten themselves because
Right.
Dr. Google has told them they're going to die.
Right. That little blood in the stool is cancer and they're
Right,
done.
right.
Yeah.
So an awful lot of understanding and interpreting what the information that you come upon on the internet is where the art and science of medicine combine. And this is where, seeing 100,000 patients differentiates you from the patient who's seen one patient.
Right.
The typical patient is the one who says, doctor, I know my body, right?
Yes.
And I'm tempted to ask them how many cervical vertebrae they have,
Yeah.
and see
Yeah.
if they
No,
know the answer,
that's,
right?
yeah. We hear
But
that a lot. I know my body.
nonetheless, they know that every time they get a cold, they need Zithromax because that's what makes them feel better.
Right.
And I I know 100,000 bodies, 200,000 bodies. I've had a little more experience than the average patient, and obviously I've read the scientific literature on a lot of these diseases, and I know things that they can't possibly know.
Right.
So you need to take the information that's available and interpret it based on your medical knowledge base, expertise, and experience.
Yeah. No, those are great points. So tell me about the book that you wrote, because I heard you wrote a book.
I've written several books. Which one you talking about? Healthcare?
Which was your favorite book that you're most proud of?
My favorite book that I'm most proud of was Everyday Crisis Management, which is an old title. I think I published that in 2011. No, 2001.
Oh, wow.
But the Healthcare Users Manual is a more recent publication. That may be the one you were thinking of.
Yes, that was the one I was thinking of.
Yeah. It's, basically it was an advertising piece for First Stop Health and kind of outlined a lot of the problems with medical care and, how to address them.
Yeah, and I think, certainly with telemedicine, what you've done with First Stop Health has done that. Looking over at your career, knowing where you started and where you are now, is there any advice you would give to young, either medical students or residents about medicine, about the future of healthcare? What kind of words of wisdom can we impart on these young learners?
Yeah, so I think one of the most important things is to have an understanding that the medical system, quote unquote, is devised and run by the bean counters today, okay, not by doctors. And you really need to think outside the box if you're going to improve healthcare. And you need to question all the rules and regulations. Why do we have HIPAA, for example, which is one of the worst laws ever written, in my humble opinion, that's cost consumers and the system itself billions, tens of billions of dollars on an ongoing basis and accomplishes nothing. Why do we have a fee-based system that prevents people from getting access to care, prevents physicians from being paid properly, and costs $3 trillion a year now, 40% of which is probably waste and
Right,
unnecessary cost.
right,
We have one of the most, if not the most expensive healthcare system in the world, and it delivers subpar results. You can get better healthcare at less than half the price in most other developed countries.
right. Do you have any hope for the future? Let's
Oh
leave on
yeah.
a positive note.
Oh yeah. I think the hope for the future is young people who are getting into medicine today, who are still idealistic and smart and innovative and willing to shoulder the burden of fixing this mess that's been created.
Yep, I agree. Dr. Friedman, thank you so much.
Thanks, Steve.